That's so funny. Thanks, Lon.
It didn't matter what email you were sending it from?
No, I was sending it from Spreemo, but I never set my name on my Spreemo account on my phone. So whenever I would reply to an email, it would say that Spreemo was emailing me. Yeah.
Pretty weird.
It's fixed.
Intimidating. God, Spreemo.
Well, wasn't that it was
Spreemo's all right.
It's like Simon says.
Yeah.
Yeah,
She smells, probably smells better than that she tastes.
It's not that bad.
Yeah.
Coming up at all?
One of those two that
Where you started.
You can try it, but
We're on camera right now.
usually comes up as this.
Is it OS?
There it is. There.
I see Nora. I see TJ saying. I don't see you.
Someone want to help Natasha?
Oh.
you needed to bring your chair.
Oh,
You can sit here.
can I sit here?
No, sit here. I'll
yeah.
sit here. No, you have a computer. It's not-
No, I'm good.
Yeah, you need a chair. You take the
I'm
bus.
good.
Can I sit
No,
here?
I'm good. I really want to see you.
I kind of want to sit in the sun too. Thank you, babe.
No one's sitting in this chair.
Anyone have a laser pointer?
I forgot mine today.
Okay, thank you, everybody. Some of you look familiar. There were, I guess, the first talk, and this will be the third in our educational talks. And essentially, this just goes back to our philosophy that knowledge is power, and that the more that everybody along the level of the process of what Spreemo is doing is familiar with the products and the anatomy as well as the modalities that we're using, the better off, the more empowered they're going to be to make either the sale or the service call or the connection, and it'll come out in the conversations and the interactions you're having with either the providers or the patients or whoever. So previously we spoke about some of the pathologies, that some of the major pathologies, and many of them are spinal, and what they look like on MRI and CAT scan. And we spoke about disc herniations and sciatica, and we went through the anatomy. And usually when I come to give a talk, almost regardless of what it is, I bring an anatomic model. But I was on 34th Street today, had another meeting, and I took the train down here, so I didn't want to walk around with a skeleton on the subway. So otherwise, really, every talk we have, and maybe we should even have one, maybe tell Ron to get an anatomic model of the spine so that we can continually refer back to it when things come up. But the last couple talks we spoke about some of the disease processes and we went through it, and then it occurred to us collectively that there would be a utility in just understanding the study itself. What exactly is an X-ray? What's an MRI? What's a CAT scan? And it's all one big jumble, as you see there. And so therefore, even for myself, we've been ordering these studies, so on a very rudimentary, basic level, let's try and get a sense of what the modality is, what it's used for, what it's not used for, what it's best for, and some of the cost differentials, and to see when you need a big gun and when you don't need a big gun. And again, it would be helpful if we had the anatomic model, but we'll try our best to use the cheap man's laser pointer and get through this. So what's an X-ray, what's a CAT scan, what's an MRI? Those are the three most common modalities in radiographic imaging. And you said by far and away, an MRI is what's most utilized here, correct? I mean, would you say what percentage of the studies that we're cited?
80.
And then what's next? CAT scan? It's got to be something. Yeah, so probably CAT scan, and then maybe occasional X-ray comes our way. X-ray's got to get passed through, and there's a reason why people don't make a big deal about X-ray, and we'll deal with that. Okay, so let's deal with the simplest modality, which is not at all simple, really, but in terms of the studies we do, this has a certain simplicity to it. What is an X-ray? An X-ray, and again, we're going to try and do this as simply as possible, so if any of you have got a significant science background, don't throw an egg at me. We're trying to do this so that I understand it. We tend to think surgically, kind of bottom line. So what's the difference what an X-ray is? But again, I want to build this from the ground up. So in very simple terms, an X-ray is an electromagnetic beam of radiation other than a visible light. It is generated from a generator. X-rays were first discovered, the X-ray wave was first discovered by Röntgen in about the 1800s, maybe late 1800s, and he had a simple generator of which he was emitting photon energy in the form of electrons. So X-rays actually have a dispensation of actual radiation in the form of electrons. And the thing about an X-ray is that once those electron beams are dispensed and they are imaging on a particular object, usually a body, and usually the body is either facing straight ahead or to the side, the AP image or the lateral image, okay? Those electron beams are then passed through that image, and those things that are dense, the electron beams pass through less so. So therefore, when you look at that X-ray and you say, oh, look at the way that looks, the things you see are the things that are absorbing the electrons. The electrons are not making their way through, and that gives the image, okay? So electromagnetic beam, actual radiation, it's the electrons that are the power here, and that those beams are generated from a generator onto a plate which captures the image. So you have generator, image, table, and a plate on top of it. And again, the denser material is what absorbs those electrons, and therefore bone, which is dense, which contains calcium, the electrons do not penetrate, and that is what gives the image. And typically an X-ray, as we said, is able to give you a two-dimensional image because it's a single beam going in a single direction, AP and lateral, and therefore we get two-dimensional images, and then we would have to kind of construct in our minds what the three-dimensional appearance of those images are. And we'll talk about cost. I have it on every slide just to remind myself that it's going to be a key player in some of what goes on here. Generator, image, and this is the table, and then you see here the housing of the plate. This is the fancy, obviously this is not what Röntgen dealt with. And the thing about the X-ray is, and we've all seen X-rays, what is it good for? What is that X-ray good for? As we said, it's the simplest of the modalities. It does give off radiation, so there is that concern about how much radiation is it giving off and what are the effects of radiation over time in regards to malignancy and cancer. And why should it have any? Well, we said those electrons are absorbed by the body tissue. So, and since they're actual radiation beams, we know that radiation does have an impact on living cells. As a matter of fact, radiation is one of the forms of treatment for a cancer because cancer are very, very active cells, and radiation looks to, or the impact of it is to directly impact those cells that are dividing. So the point is, it has implications about radiation, although when all the smoke is cleared, there's really no good literature to suggest that even on a young fetus, a pregnant female, that an occasional chest X-ray, which gives off a very small amount of radiation, or even a pelvic X-ray has any impact whatsoever, okay? But nonetheless, being honest about it, there is a radiation expense to the modality. What is it good for? Bone. As we said, since bone is dense, the more denser the material, the more likely you are to get an image by which the electrons are not passing through, so we get a sense of how, of the bony architecture as it really is. When Röntgen first discovered X-rays, he did the first X-ray, the first known X-ray was of his wife's hand, and her comment was when she saw the X-ray, did anybody know what she says? It's kind of famous in the radiology world, I have seen my death, because it really looks the way it is, okay? And it looks like a skeleton. And so this will be our index picture that we're gonna look at. We're gonna compare the different modalities. So at the end of the day, we'll be able to actually quiz ourselves in terms of these modalities. This is your, let's see, from previous knowledge, AP, front image or lateral image of the spine. Anybody want to take a guess on that? That's a lateral image, right? We're getting more and more comfortable. So let's, despite the lack of our model, let's just review some of the anatomy. We have anterior, the front of the body, posterior, the back of the body. This is the lower lumbar spine, and we know the lower lumbar spine is not straight when viewed from the lateral, it is lordotic, right? It's going into the cave. You see it forms a C shape, and this is essentially a normal lateral image. Why do I say that? We're seeing bones here. Anybody remember what they're called? These are the bodies, the vertebral bodies, vertebral bodies, vertebral bodies, vertebral bodies, and this is the fifth lumbar, lumbar 4, lumbar 3, lumbar 2, lumbar 1, and I know that to be the case because of two things. I know that this appearance here is the sacrum, S1, and I also see a rib here. So that's T12, the last thoracic vertebrae. What is this in between here? The thing that looks like air. Those are the intravertebral discs. Those are the discs. Now why are they not coming up? Because, are they dense? No. What are they mostly filled with, the discs? H2O, water. So what we see on an X-ray, again, is what's not passing through. The bones, high mineral density bones, are absorbing these electromagnetic beams and giving us the image. So all this, which doesn't have a lot of contour, is there anything here? Of course. There's skin, there's fat, there's muscle, but we're not seeing it. We're kind of seeing it as black as air because it's not absorbing the electromagnetic beams passing through onto the plate. Same thing here, we see these patches of air. It's interesting, you show a patient an X-ray, they're like, they don't ask you about this, they say, what's this? Everybody picks up on the air, so what is that? And then that's basically, that could be air in the colon, it could be a vessel going through, we don't know 100%. There's no probability these are air patches in the intestine. So we're not getting a lot of definition in terms of the soft tissues at all. The discs, are we able to say what they look like internally? No. But we are able to say the height of these discs. Are these good heights? Pretty good. They're pretty good disc heights. Now, can I see the nerves at all here? Absolutely not. So it's a good, simple, again, not simple, it took a lot to discover an X-ray, but it's a good, quick, readily available study to determine basic bone anatomy and the bone architecture as it really is. This is the lateral or AP image. That's an AP image of the lumbar spine. And you're seeing frontal shot. This is the vertebral body, vertebral body, vertebral body, vertebral body, vertebral body, sacrum. So this is L5, L4, L3, L2, L1. What's in between here, this air? That's the disc when viewed from the front. Okay? So if we had our model, it would be easier to understand, but you're seeing two-dimensional image in the AP front, two-dimensional image from the lateral front. Okay? Move on. CAT scan, probably in that 12%, I would say, probably 8 to 10% of those studies are CAT scans. What are CAT scans? In a certain sense, and we're going very bottom line corporate. A CAT scan to a certain degree is a fancy X-ray. Why do I say that? It dispenses electromagnetic beam, radiation waves, electron flow, but as opposed to doing it in a linear fashion, it does so through an axis beam. So that these electron beams are rotating through an axis, being fired from different parts. So with that in mind, where is the radiation exposure going to be greater? In an X-ray or a CAT scan? CAT scan by multiple magnitudes. Okay, so we talk about what's got the greatest radiation exposure. Is it in 50 X-rays of the lumbar spine or one CAT scan of the lumbar spine? I'm not sure about this, but I think it's a CAT scan. It's just the magnitudes are much much higher, and that is because the electron radiation is coming across an axis and through the beam, again, ultimately onto some fancy plate, and that's what's taking place here. Now, let's just talk about, let's bring into the picture a time factor, because I forgot to mention it. X-ray, quick study or long study? Quick, moment. CAT scan, quick study, medium, or long study? Medium. Again, electron beams, pretty simple, but the fact is it's got to go around that axis, so it takes a longer time. So the average lumbar spinal CAT scan time is, let's say, 15, 20 minutes or so. Again, give or take how quick the technician is in getting things set up. It's about a medium level study. So what are some of the issues you have in this? Claustrophobia. Well, the way it's set up, it's not a completely enclosed unit. So claustrophobia is not as big an issue, but the patient has to be supine. It is somewhat circular, so there could be some issue of patient anxiety with this. But essentially, it is a fancy X-ray, electron beams, and it gives you, and since it's electron beams, how is it going to be, and based on what we know about these, how electrons are absorbed, will it give us good definition of bone or not such good definition? It'll give us great definition of bone, because it's taking those images as an X-ray does, but around an axis. So therefore, we're able to see AP images, lateral images, as well as down the tube or axial images. And we even, once you put all this together, on the fancier units, we can actually reconstruct it into a 3D image. So an AP image is two-dimensional, a lateral image is two-dimensional, even an axial image is two-dimensional, but given the computer programming, the machine can put it all together and actually give you a 3D recon, which is something you'll see on some of these readings, 3D reconstruction, and that's based on the technology. So what is it good for? Radiation beam, we said, electrons, much higher doses, beams around an axis, allows for three-dimensional imaging, allows for axial imaging, down the tube looks, and there's also some cost associated with this. Just your general sense, what's more expensive, an X-ray or a CAT scan? Probably a CAT scan, okay? It gives us great definition of the bone, but in my opinion, it doesn't show the bone in terms of the way it really looks in the body as well as an X-ray. It'll give you nuances of bones better than an X-ray. If there's a spur, if there's a certain amount of arthritis, you're going to see it better on a CAT scan. But the actual appearance, the actual height of the vertebrae, less animated, is actually seen better on an X-ray. Now, overall, if I only had one study to get, a CAT scan or an X-ray, I would say get the CAT scan. But there are some elements of an X-ray. I want you to understand that. So sometimes the biggest gun is not necessarily the gun you need. Overall, CAT scan, much more data can be made from it, and you do get some definition of soft tissue, much more so than an X-ray, although much less superior to that of an MRI. So good for overall architecture and as well as soft tissue. So here is a lateral CAT scan of the lumbar spine. Again, sacrum, lumbar vertebrae L5, L4, L3, L2, L1. Okay, what are these? Invertebral disc. Do we see these discs with a little more clarity than we did on an X-ray? Yeah, we do. You can make out some contour here. You see how it's bulging to the front. Do we see the nerves here? Not really. Not really. Do we see a little more definition of what's going on in the soft tissues? We do. You see here's this colonic gas, which that really does look like an intestine now, right? And you see some of the vessels here, but again, it's not super for the soft tissues. Could we do something to this CAT scan to get even better definition of the soft tissues? Yes, we could add contrast or dye material to it, and that dye material would go through the blood vessels, so if we wanted to, if it's a vascular CAT scan, we would be able to light up these vessels. If you wanted to get a CAT scan after eating or drinking something to get a dye study, which GI doctors do, you'd see barium light up this way. So CAT scan does give you that ability as well, with contrast and with some barium, to get some soft tissue, some higher definition soft tissue, as well as the programming of the CAT scan can select out for bone, or it can select out for soft tissue. So we can get a lot more soft tissue data from a CAT scan, and I mean a lot more, than an X-ray. Okay?
No question. So if a CAT scan's being requested with contrast, they're probably looking at something like, would you say they're probably looking at something related to the soft tissue, or like they're,
Either something into the soft tissue, either something into the blood vessel system. They could be looking for an abscess, a collection of something.
okay, so they wouldn't necessarily be looking at something like directly related to the spine?
They
if they're
could,
asking?
they could. There is a study that, again, skipping forward a little bit, the best study, they had only one study to get and don't want to blow it, and the patient will only tolerate one study, be an MRI. Let's say the patient can't tolerate the MRI because of their claustrophobia. You try an open MRI. Let's say they can't tolerate the MRI, can't do an MRI because they have a pacemaker. We'll discuss why a pacemaker at times is a contraindication. There are certain people that can't get an MRI. What's your next best study? A CAT scan myelogram. And a myelogram is a test in which myelin is the nerve mass. The contrast or dye material is directly injected into the spinal canal. So now, once it's similar to an epidural, which most women will have when they have a baby, when they give birth, the contrast matter is injected into the spinal canal, and therefore now you've got contrast material centrally within the canal, but it'll also spread along the paths of the nerve roots. So now all of a sudden you're coming close. Once you put everything together, you're coming close, and in some cases even gives you like kind of a more real-time look at the spine than even an MRI. So the answer is most CAT scan with contrast is going to be in a look to determine either soft tissue, blood vessels, but you can make an application via myelogram to look at the spine itself in phenomenal detail. It's still a great study. So that may be part of that 12%, that a few percentage are going to be CAT scan myelograms.
Different question. So a CAT scan, you can have the AP view, the lateral view, and the axial view.
And then we can put it all together in a 3D
do all
recon.
360, right?
Yeah, 3D
Like it doesn't have to
recon.
be directly down, it could be from any angle.
Yeah, they'll actually be able to put together, and when are you going to need that? When would you like to see that? Deformity cases. You're not going to see it too much in trauma, but you're going to see if someone's got a spinal curve and you're plotting out what needs to be done with that spinal curve. It'd be nice to see an AP and a lateral and then an axial, but then ultimately look to like put this together and spin it around and see what it looks like globally, and that can be done with the software programming in some of the better units,
Okay.
So that is for the CAT scan, and again, we can get an AP. I'm sorry, this did not project well. This is your lateral CT. This is your AP. It looks similar to an X-ray, but you're seeing some of the nuance. It's better. You're seeing some of the nuance better than you do on the X-ray. But you wouldn't say that this is really what your body looks like. Renton's wife was one, and she really did. Her hand really did look like that in exoskeleton. So it looks less like this in real life, but certainly you don't have a big transition in terms of understanding what's going on here. You become reasonably familiar with this reasonably quickly. We said X-ray AP lateral. We said CAT scan AP lateral. What's this image called? Axial, A-X-I-A-L. Axial, we're looking down the tube. Here's the front, here's the back. This is the spinal canal. Okay? And these are, we won't go into it, this is actually not a normal axial view. We're seeing a cut right through here, through the bone, and that is a pars interarticularis defect, which can sometimes lead to a spondylolisthesis, which is a term we spoke about, movement of the spine, or really a spondylolysis, which is a break in the spine. So this is not a completely normal study, but my point in just showing this to you is, again, AP lateral and down the tube. Then we get fancy computer programming software from GE, and all of a sudden now we can spin an image in three-dimensional recon. Now the granddaddy, MRI, magnetic resonance imaging. He said that the X-rays and CAT scans are both forms of electromagnetic radiation other than light with utilization of electron power. An MRI, so I don't mess this up. Unlike CTs, which use X-rays, MRI scans use powerful magnets, magnetic fields, radio frequency pulses, radio waves, to produce detailed pictures of organs, soft tissues, bone, and other internal body structures utilizing not electrons but protons. Again, those of you with a significant science background will understand this much better than I do. But when all the smoke has cleared, what has less radiation? A simple X-ray or a 30-minute MRI? MRI uses very little or no to understand radiation. So there's really not, it's a different modality. As we said, a CAT scan is like a super souped up X-ray. An MRI is a completely different modality which uses protons via magnetic fields, and a lot of the power based of an MRI, and we'll have some segment on quality, but we'll bring it up now, is based on the magnet size, right? You can have magnets from 0.2 Tesla all the way up to, it exists 7 Tesla, but for medical commercial use, kind of the Rolls Royce is the 3 Tesla. Who was Tesla? Nikolai Tesla was a Serbian engineer who came to this country in the early 1900s, originally worked for Thomas Edison. He was very eccentric personality, very dynamic, and just went off on his own, various different projects, and he gave us a tremendous understanding of magnets and magnetic fields. And so his legacy, at least in terms of the MRI, is he gets the heading for the magnet size. And they quantified the size of the magnet based on Tesla units. Don't ask me any more about it. That's the extent of what I can tell you. But that it's a completely different modality. And as a result, it looks similar to a CAT scan because it's also sending these super duper proton magnetic fields around an axis. But as you see here, you're going in through this is called the bore, the internal pit of the MRI, and there's depth to this MRI, so there are bigger issues in terms of claustrophobia than you do have with a CAT scan, and certainly non-existent issues when you deal with an X-ray.
I have a question. Why would any doctor order a patient be seen for an MRI of the lumbar and cervical at the same time, a CT of the lumbar and cervical? I know that's come in, and I just don't understand why a doctor would order someone to have the same thing done as a CT scan and an MRI. Is there any advantage to that?
You're saying one patient, right, with a CT of lumbar
And thoracic.
and thoracic,
and then,
as well as MRIs of all those areas.
Yeah.
Okay. Don't mention the doctor's name. That usually speaks of overutilization.
That should be red flagged when that comes through. Or?
I'm not, again, we want to talk academically, and we want to talk, we're not here to implicate flags or whatever, but if you're seeing that a lot, that sounds like an overutilization. Again, there are times it can be indicated. I'm not saying I've never done it, you guys, you're too young to, there was a game, Asteroids, that maybe we brought it back a couple times just for fun. When you're like in real trouble, what do? There's that function, smart bomb. Everything blows up, right? So you only get a couple smart bombs. They give you 3 smart bombs where you get to save your life. And then after that, it's like you can't handle the asteroids one by one, you're out. The MRI of this, that, and the other, it's a smart bomb. You order an MRI of the cervical, the lumbar, the thoracic, plus put some CTs on there, you're not going to miss any pathology. You're going to pick up who knows what. But most of the time, most people have one thing wrong with them, right? Again, I've definitely ordered MRI and cervical and lumbar at the same time, MRI thoracic, but it's kind of the same sitting. MRIs, 3 areas plus CAT scan. Usually, it's coming up a lot. It's too much.
What's your experience with pregnant patients? As far as I know, obviously, like you said, with X-rays, the radiation is very minimal, so they usually allow pregnant women to have
Realistically, they're not often allowed. Realistically, we'll talk. This is what will happen. Patient will come in, they'll say, "Oh, doc, I'm not pregnant." First thing. Then the technician said, "But she's of pregnancy age," and they say, "Could you be pregnant? When was the last time you had a menstrual cycle?" "Oh, it's 3 months, but I'm definitely not pregnant." So this is what goes on, and then somebody gets scared. Either the patient, usually the technician. Yeah. So you could also shield, if you're doing an X-ray of the forearm, you could shield the gonadal region. that's in real life what happens. Furthermore, looking at it academically, but also realistically, if there would be a issue to the fetus, when would that be? Would it be first trimester, second trimester, third trimester? Now we're going to college biology. Well, anybody? First trimester. First, and why is that? It's organogenesis. That's when the activity, that's when the 2 cellules are 4 and 4 to 8, and everything starts to happen. So, if it were my wife or anyone I knew, and they needed an X-ray, and certainly if it's after 3 months, I would say shoot the X-ray. Frankly, pregnant women break their arms, right? You're not getting an X-ray on them. You do. You know what I'm saying? Pregnant women that are in car accidents, they break a femur. There's papers written about femur fractures in pregnant. There's papers written about everything, but I'm saying it needs a certain amount of X-ray to do that. There's nothing to show that mild X-ray doses causes any problem at any stage.
With the other modalities, like a CAT scan, from my understanding, is never just due to the radiation. And MRIs, like we've had, again, like in my experience, we've had a few that it's just happened, but other facilities, they say no, if the patient's even thinks they may be pregnant, we won't do it.
Do an MRI.
Correct.
Okay, based on?
I believe from, again, what I've heard, and this is just from technicians, is the magnetic field could affect the fetus's hearing.
Theory, though.
Yeah.
I've not seen, if you may know more than I do in this sense, have you seen anything, let's say, really established peer review literature? No, it's a lot of, problem with a big world that's very well connected via internet is all of a sudden you could promote different occurrences, and then all of a sudden that becomes a kind of viral bad knowledge, right? Woman has MRI, delivers baby with hearing loss. Happens, let's say, at 2 centers. It's a big world. That's going to happen. Does that have anything to do with the MRI? Who knows? But that's going to be, that'll be out there. So I don't know of any science behind it, but now magnets do have impact, so we don't really know. We know it's not radiation. What is it good for? It's kind of good for everything. It's good for bone. It's good for soft tissue. It's good for nerve, blood vessels. It's going to be a cost associated with all this good stuff. Okay? So, comparison. Front or back of the spine? Front. Back. It's a fancy name for back. Posterior. Fancy name for front. Anterior. Is this a bone or a disc? Bone. Okay. What number bone is this? Lumbar. 5, 4, 3, 2, 1. Sacrum 1, sacrum 2. Most of the time we're just dealing up to S1. We talk about L5, S1. If you were to label this disc, would this be disc L3-4, L4-5, L5-1, 4-5? Here's 4 vertebral body. Here's 5 vertebral body. And that's the disc. 5-1, 1 because S1, sacrum. We just say, based on everything we've discussed today and in the past, that is a healthy looking spine, unhealthy looking spine, old spine, young spine.
L1 disc.
Little funky? Yeah. How about the other disc look? Are they narrow? Are they have good disc height or narrow disc height? Pretty plump? Pretty good, right? We said on this sequence, we're not going to talk about a lot about this today, we did this the other time. This is a T2 sequence, or T2-ish sequence, because fluid and water is coming up white. So this is, in youth, we have the greatest amount of water. So is this an MRI of the young spine or an old spine? It's an MRI of the youngish spine, because you're seeing good height, you're seeing a lot of fluid content. And this fluid is the fluid from the cerebrospinal fluid surrounding the gray matter of the nerve. So what are we seeing here? Anybody know what this is? This is the back of the person. So what is this? It's fat. Coming up white too. Okay. Again, the reasoning behind the coloring not so important, but we do know fluid white, fat comes up white. What is this? This is the muscle and the posterior spinous processes. So we're seeing a lot of definition between the soft tissues and the discs and the bone. But there's a certain Mickey Mouse nature to this, isn't there? Is this really the way your body looks? Not really. The X-ray and secondarily the CAT scan is more along the line. This has a certain animated quality to it. And then as we could do significant more cuts, we could see the vessels much better, the intestinal things, and we're seeing the head of the hips. We're seeing, I'm sorry, this is probably the uterus here, okay? All the things that are harder to see on CAT scan, much harder, if not impossible, to see on X-ray. So young spine. How about this? Young, old, medium. I won't quantify what old is anymore, or medium, but what would you say? Is it a 15-year-old spine or a 50-year-old spine? Why?
Less water in the discs.
Less water in the disc, yeah. Is it
But they're
okay?
still like thick.
Beautiful. They're still, the height's good,
Yeah.
right? So 95-year-old spine, probably not. Although, you'd be surprised, some people go through life with phenomenal spines, you know, something else, you know, something else can come up. But probably, if you had to ask me where to guess, I'll put this in the 40 to 60 category, or maybe younger, 30 to 50. You know, you can have some black discs, you know, you lose water content, it's still a good look, overall good looking spine. Coronal image, AP image. So you're seeing lateral image on the MRI, AP image, and you're seeing a lot of activity here. You're seeing the spine. What are these guys? Kidneys. Right? What's this? This is a muscle on the anterior aspect of the spine known as the psoas, P-S-O-A-S. This is the psoas muscle. Front of the sacrum. There's activity here. The point is, here's the right side, that's the diaphragmatic liver, or the liver itself. And so we get a lot of soft tissue detail, bony detail, nerve detail. See how, you know, this looks like a pretty well built person, not a lot of body fat on the sides of the flank here. As well as that axial image. Right? We can look down the tube. Not commonly in use, though, is three-dimensional MRI reconstruction. So in that sense, the CAT scan has a certain advantage, although, again, it's a limited application that you really need a 3D recon. But the MRI is best for those AP lateral and axial images, and all the detail that you're seeing